All right, so today we're going to go over what is the MAP and why are we even sitting here talking about it. So the MAP is also known as the mean arterial pressure. And effectively what this is measuring is it's telling you the average blood pressure in the body. And that's really helpful. You know, a lot of times you go to the doctor and they tell you your blood pressure is a top number over a bottom number. And so what number do you focus on? And most people focus on the top number, and that's usually a pretty good way to go by. But, you know, as a whole, we want to get like a mean idea of how well are my major organs being perfused. So that's what the map can tell me. And really keeping a map above 65 is our usual goal. So if I have a patient who's on vasopressors or other medications to keep their blood pressure up, I usually am trying to keep a goal map of greater than 65. But every patient's a little different, and depending on, you know, what their history is, why they're in the hospital, that's going to be individualized. So one of your fun tasks for this semester is learning how to calculate the map. And so um, what am I called? The equation for figuring out a map is calculating the systolic blood pressure plus 2 times the diastolic blood pressure divided by 3. So this is how we calculate MAP. And so I'm going to kind of tell you the method that I use. So we have to do 2 times the diastolic blood pressure. This is not systolic blood pressure plus 2. Otherwise, you can sometimes get confused. So I always start by multiplying 2 times the diastolic blood pressure. Then I take that number and I add the systolic blood pressure. And then I divide whatever that number is by 3. And that's kind of the process I take. And to make it easier, I figured we would go ahead and actually get some practice. So let me do this and make this bigger where you can see it. Let's get some practice together. So my blood pressure, and let me get my handy dandy calculator because I am not a human calculator. So like we said, first thing we're going to do is we're going to take 2 times the diastolic. So I'm going to do 80 times 2 equals, and I know that's a pretty simple one, but I never trust my math. 160, sleep deprived always, right? So 80 times 2 equals 160. So that's what I'm going to start. Then I'm going to add that. I'm going to take this number plus my systolic blood pressure, which is 120, plus 120, plus 120 equals, that equals 280. And then I'm going to take this number and I'm going to divide it by 3. And that equals 93.333. And these are always a whole number. So we're going to do 93. That is what my mean arterial pressure is. Great. And then, you know, we can also see what it's like if their blood pressure is low. So what does the map kind of end up as? So first we're going to do 40 times 2. And that's going to equal 80. Then we're going to add the top number, the systolic blood pressure. So we're going to add this one. So 40 times 2 is 80. Then we're going to add that systolic. And 80 plus 60 is 140. And we're going to divide that by 3, which equals 46.66667. So we're going to round that up to a map of 47. Last but not least, let's kind of see what someone's map is when it's maybe on the higher side. So we start out with our bottom number, 76 times 2. So 76 times 2 equals 152. And hopefully I would assume your professors would give you like an even number where you won't have to worry about rounding. But if you're not sure about rounding, you can always ask them. So 76 times 2 is 152. And I'm going to add again that top number. So 152 plus 180. 152. Sorry, my calculator's being crazy. 180 equals 332. So I got 332 divided by 3. And that number is 110.66667. So that would equal a map of 111. So you can see here, kind of comparing these, like when your blood pressure is kind of in the middle, your MAP is good. It's above that 65. You're getting good perfusion. When my blood pressure is low, my mean arterial pressure is low, or my MAP's low. So this is 47. So this is really telling me this patient's kidneys are not getting good perfusion. And you know what happens when the kidneys get selfish? They start secreting that renin-angiotensin aldosterone system and start trying to get their pressure back. So it can be a whole other level of story. So that's a different PowerPoint for a different day. So then there's also when your blood pressure is high, then your MAP is also going to be high. So you can kind of see how these all correlate together. But just getting a lot of practice doing these is really helpful, and it's a great way to kind of get started and better understanding how to do these kind of problems. Hope this was helpful. See you next time.